So the next, I think.
Now I invite Dr. Viral Shah, who is the chief instructor, and the topic is related to consents. Consents are very important. So the correct process and method of obtaining informed consents before ophthalmic procedures. Before Dr. Viral Shah starts, I should tell you that at All India Ophthalmological level, there is one booklet which has come that is about informed consents. And those informed consents were in the language English. And basically, the consent must be in the local language. So we have translated the whole booklet. Our team, Dr. Rajesh was part of it, I was the chief coordinator. And we have come out with that particular consent booklet. It's easily available on MOS website. You can download that particular procedure related consent. And the same has been transferred by another language people in another few states of India, and that process is still continued. Over to you, Dr. Viral.
Thank you, sir. So the correct process and method of obtaining informed consents before ophthalmic procedure. So we all know there are printed forms, ready-made forms, but what is the correct process? How to go about it, how to convince the patients and relative, how to counsel? I would like to stress a little bit about that. So informed consent, the law as it stands today, essential guidelines, understanding the problem, why informed consent is needed, why patients decide to sue or file complaints, relevance of a consent form, conveying caring attitudes with information, the process of informed consents, and integrating the process and the form, and of course various model consent forms. So informed consent, the law as it stands today, as a starting point, it is necessary for all of us to understand some of the basic legal fundamentals behind consent law. What is the definition of informed consent? Informed consent is defined as a process for getting permission towards medical treatment by a patient granted in full knowledge of the possible consequences, risks, and benefits. Most Western countries have already shifted towards patient viewpoint standard. That is, the information disclosed should be based on what a reasonable person in patient's position would want to know in similar circumstances, whereas in our India it is a reasonable physician standard which defines disclosure based on what a reasonable doctor should disclose in the medical community, should customarily disclose to the patients under same or similar circumstances. The law clearly states that ophthalmologists or doctors have a non-deligible duty to disclose and discuss with patient. Non-deligible is you cannot give it to your subordinates or anyone. It is your duty to take the consent, at least inform the patients about that consent. And the point that should be covered are the diagnosis, the nature and purpose of the proposed treatment or procedure, risk and benefit of the proposed treatment, alternative methods available, and the risk and benefits of such alternatives, and risk and benefits of no treatment. So why this informed consent? What is the problem? Why these informed consents have cropped up? So almost 95% of ophthalmic negligence court cases decided during the last 5 years were terminated in favor of the ophthalmologist. So ophthalmologist won all the cases, 95% of the cases. The question arises, why these cases were then filed when there was no chance of the patients getting any relief from the court? The simple answer to that was the patients sue regardless of negligence because they are surprised by the clinical outcome, or they are angry with the provider or the ophthalmologist who they strongly believe to have caused this grief. General assumption that most patients are motivated by personal greed or predatory lawyers are unproved and not usually the fact. All data in literature suggests that most patients or their family members who file family court cases and claims regarding medical negligence strongly believe ophthalmologists did not warn them of the potential medical problems and doctors tried to mislead them. In such a scenario, when such emotional factors are involved, even the best constructed legal forms, consent forms, becomes virtually powerless to forestall litigation. You have to face the litigation. You may have taken the consent and that you can provide as a evidence in the court, but litigation you cannot avoid if you have just signed the form and not gone through the informed consent process and given counseling to the patient. Consent form coupled with patient's perception that important clinical information was personally conveyed by a caring physician could help prevent many unexpected medical notices. A physician who expressly, you have to convey caring attitudes with information. You have to show to the patient and their relatives that you are caring for them. So you have to have certain express certain clinical uncertainty if there, empathize with the patient's wish for positive outcome. Consent activities, the process for informed consent. The process starts when the patient first encounters the doctor and continues through the operative and post-operative treatment phase of the care. Forms and signatures are merely an end stage culmination of the process, and it is not the focus of the process. Informed consent is still regarded in many ophthalmic practice as a discrete legal event rather than an interactive process. It is important to change this mindset of ours in the entire and the entire patient care team has to be sensitized regarding at the same time to alter this procedure. Hospital support staff, they are very important. Nurses, paramedical personnel and administrative assistants, they must be encouraged to shift their focus from paperwork of consent to the ongoing process that is continuously happening. Documentation is important but should not be the sole objective. When possible, start the consent process as early in the continuum of care as possible. This doesn't mean immediate recitation of risk benefit, अरे ऐसा करेंगे तो ऐसा हो जाएगा, ऐसा नहीं. बट यू सेंसिटाइज कि आपको ऐसा ऐसा बीमारी है, ये पॉसिबल सॉल्यूशंस है, आपको ये करना चाहिए. सो यू स्टार्ट सेंसिटाइजिंग द पेशेंट अबाउट ट्रीटमेंट्स एंड अल्टरनेटिव, and interactive exchange of relevant information should be done. A large number of patients and their family perceived that doctors would not talk or answer questions, and many believed no one in the hospital was listening to them. Try to make arrangements to have family members present and included when discussing patient's disease and the planned medical treatment or surgery. During the initial or subsequent visit, introduce the consent form and explain its purpose. Clarify that the patient form is intended to help both the doctor as well as the patient. The important facts which matter to the patient have been discussed and are understood, and be very frank and honest in your clinical uncertainties. Give the patient a copy of the form for or documentation either before or after it is signed. This is important since some studies suggest that patients believe doctors cover up or downplay important information. Fear about giving patients a copy of the consent form is usually worse than it is a reality. If patient appears troubled over the risk and uncertainties, you again counsel them and empathize with their wish for a good result. Accept their ultimate decision even if it doesn't agree with your clinical opinion. This is their right under the law, and if the informed consent process was properly handled as described earlier, there should be no animosity. When possible, make contemporaneous note in the patient's record during all phases of consent process, even if a form is used. Nowadays, they are also saying that you have to video record the process of consents, important consent, but it is not law. It's law only during transplant procedures, even only during transplant of vital organs, not even corneal transplants. So kidney transplant patient, video consent is a must, but in ophthalmology they have not yet made it a law. When possible, make contemporaneous notes in the patient's record during all phases of the consent process, even if form is used. The best way to document such information, and more importantly to record that a consent process took place, is still through the use of pre-established forms. So nowadays AIOS, MOS and all bodies have come up with beautiful and comprehensive forms. You can download it online also, or it is available readily with their office, or you can contact any of our instructors. They will provide you the link or pro forma of how the consent for various diseases can be taken. It is essential for each members of practice management team to regard such documentation not as just another document to complete, but as an important informational tool to establish a strong relationship with the patient and ophthalmologist. Short form entries should be avoided until handwritten entries can be improved to the level where their evidentiary value consistently exceeds that of properly developed re-established form. The printed forms are the way to go. The use of consent form for most operative procedure is still the best way for ophthalmologists to document the whole process. There is no one right or wrong answer in designing an ophthalmic consent form. Like all parts of the medical records, the consent form must represent that the ophthalmologist made a reasonable effort to effectively carry out this important duty as part of patient's ongoing care. A number of ophthalmic specific forms are already available on various websites. You can visit any of these: DOS online, AIOS online, MOS online, or you can contact us. Thank you, that's all.
Thank you, Dr. Viral, for wonderfully covering the topic. I think it's the need, your
Can I ask
documentation
one
must be perfect.
I just wanted to know whether the consent form that we are making patient to sign has it to be in the mother tongue, or it will be Hindi or English is
Even
okay?
if it is in Hindi or English or not in a mother tongue, you have to mention that he has been explained everything in the mother tongue of the
Acha.
patient.
If we just write down in our
Yeah,
own handwriting, is it?
because he is a Punjabi or a Bengali patient, you may not be having that form with
Yes,
you
yes.
in Maharashtra.
Yes, yes.
So you have to mention that you have the patient and relatives understand, you have explained the whole process in their language that they know.
Okay.
But they can sign it and they can write a line that I have been explained in my mother tongue the whole process.
The patient has to write on.
Patient has to write, and you have to take a signature of witness of their relative.
Some relative of the,
Sir, this is the basic. If there is no consent form, your case doesn't stand. This is the first evidence they will ask whether consent was taken or not. In evidence, this is the first document they will ask.
something bad happens to the patient by chance, and suppose his consent is not taken, everything goes against you. Suppose you have taken consent, at least you were in a position. The cases have happened. One of the colleagues who was general surgeon just took out the cyst and the patient was dead on table. The consent was not taken. Afterwards, he tried to take the thumb impression of the patient, and the patient was illiterate. So thumb cannot be correlated. So not to have consent is a very bad thing.
Consent is a must before any incision or any procedure in the body, unless otherwise it amounts to assault.
Sometimes the blood relative is not present. So if the attendant signs.
Yeah, attendant or friends or someone, but you should mention their name and mobile number there. You should get there.
Basically, you can have two witnesses. Most of the times, if you take the witness that is a relative of the patient who can go against you, and you can have another witness who is not in relation to the patient but some other patient's relative. So both those witnesses will be working, one in patient's favor, one in your favor, and that way you can do it.
So, but according to the AIOS consent form, there are two parts to it. First is the information, below which also there is a sign that we have explained this, and the second part of the consent is on the day of surgery when they are going to go for the surgery.
Yes, that is the process of consent. That is the whole process. Even if in the OPD also you need to take consent for some procedures
so
like
that
FFA and all
As an
that.
independent witness, then you cannot take your staff with signature.
Just no, I can say about that. Sometimes patients and relatives, they say that the consent was taken so early. Other objection is consent was taken so late, that is on the day of surgery. So there is a choice that when the patient is coming and finalizing the surgery, you can give the consent form to the patient, ask him to read at home, get that signed with him, and again on the day of surgery you can have another consent form. So that way you have told the patient beforehand, that is quite early, and then on the day of surgery, that is not that.
So, like how I follow is I have two forms. One I give, it is attached in the file only on the day they come for the A scan. We take the consent, explaining the fact that we have explained you the surgery, and on the day of surgery, the second part of it, which is there, which is for the surgery.
Yes.
That's good.
So that is the.
That is
time
the correct-
No,
that
but
is the
I'm
correct
asking
way.
you as a second witness when you said. Is
They
your
can be-
staff, Is your staff member eligible
Yeah.
to be a second?
Yes.
witness?
Yes. In suppose nobody is available, if you can definitely do that.
Yeah, one more thing I will add to this discussion. Nowadays, most of the practitioners, they email or WhatsApp consent form so that patient goes through everything, and whenever he comes for the surgical procedure, whatever, like scan, what you told, then he can sign the consent form because he understood the whole process. That we can assume. And apart from that, there won't be any queries. If at all, if he has got some queries, he can answer. He can ask that time, and we can answer properly.
But the weightage is given to the form that is signed on the day of the surgery. The weightage will carry, because if the first form is not there and second form is there, that's it. But if the first form he has signed after 7 days, 8 days when he has come for a scan, and on the day of surgery you have not taken consent, it won't carry any weightage.